Candy canes are such nice decorations. Is anybody getting flashbacks from physical assessment class? We use this acronym to remember the symptoms of a cardiac assessment, and usually with the cardiac assessment, these symptoms indicate a myocardial infarction. Now, during an MI, there's a clot somewhere in the coronary arteries that's preventing oxygenated blood from reaching cardiac tissues. One of the ways we diagnose an MI is by measuring the cardiac markers, and one of those cardiac markers is troponin. Now, troponin is released into the bloodstream specifically with skeletal muscle tissue and cardiac muscle tissue when it's deprived of oxygen. We usually see troponin elevated 3 to 4 hours after an MI, and it can stay elevated in the bloodstream for 10 to 14 days. We'll actually do serial MI measurements where when a patient comes into the ED, we'll take a measurement and then we'll take another one 2 to 3 hours later to see if it's risen from their baseline. But there's a problem. When we send blood off to the lab, oftentimes it takes over an hour for the results to come back. And time is cardiac tissue. So, what's the solution? I believe the solution is the Abbott iStat point-of-care troponin system. This system allows us to take bedside troponin levels within 10 minutes. So, how do you use this device? Well, first of all, you'll gather your supplies. You'll need blood draw supplies, the iStat machine, and the cartridges that go along with the machine. You'll go into the patient's room and do some preliminary setup. First, you'll turn on the device and scan your operator ID badge, which is usually located on the back of the nurse's hospital ID badge. You'll scan the patient's wristband and you'll scan the cartridge packaging. Once you've scanned these things, you can go ahead and draw your blood. When you have the blood in a small syringe, you're going to take 1 to 2 drops and place it on the space indicated on the cartridge. When you see the cartridge fill up with blood in the chamber, you can go ahead and close the closure device. Pick up the piece and stick it into the iStat machine. When you've done this, you just wait 10 minutes, and laboratory results are actually sent directly to the client's lab levels in the computer. So, what are the benefits and what are some of the setbacks using this device? When we talk about the setbacks, I think the solution is pretty clear to see, but we'll get there in a moment. So, what are the benefits? This device is easy to use and gets accurate results. We're getting results at the bedside, which means we can initiate treatments faster. In fact, the door to troponin time was decreased by 50 minutes using this device. Patients are getting to cardiac catheterization and thrombolytic therapy faster, which is saving cardiac tissue and saving patient lives. Another benefit is that one study showed that this device improved communication and workflow in the emergency department between the staff, and that's a big deal. The emergency department is kind of organized chaos, but this device can smooth things over with cardiac patients, making the procedure simpler and the diagnosis faster. So the setbacks. It requires annual training to use this device. From a nursing standpoint, it's a bummer. It's another certification you have to complete yearly. However, from a management standpoint, this gives you confidence knowing your nurses know how to use the equipment properly and how to be cost effective with the equipment. The next 2 setbacks I can kind of group together because I want to explain that they're easily solved. First, the device can malfunction. It can time out and you actually won't get a troponin level at all. Second, it could be a critical lab value, but no laboratory technician is calling you to tell you, hey, you need to go assess their patient. Your troponin level was really elevated. But the solution is pretty clear. If a patient's having active MI symptoms, if they're having chest pain, shortness of breath, if they're nauseated and vomiting, you're going to be in the patient's room continuing to assess, continuing to initiate treatment and other tests. You're going to see on screen whether or not the device timed out or the troponin was a critical value. The true setback I see with this is the device is expensive. Cartridges can cost over $500, and you're using multiple cartridges to test on the patient because we're doing serial troponin levels. However, I believe implementing this device is critical. It saves time, which is saving cardiac tissue and saving patients' lives.